Nice to see physical events happening again. A couple of good events in recent weeks. We had a good talk by Mr. B.V.R. Bowen Reddy recently, and which also was a large monthly startup Saturday event that happened here. So we had this room full that day. We had all our first year students also come to listen to his talk on his journey creating a large enterprise. And so nice to this, our center, our whole Applied AI center started in the pandemic, right? And a lot has happened in the last 2 years, and like we don't get to see much. We're all quietly happening, but we're not all very rarely meeting. So we said, like, let's do it physical, a small one, but let's do a physical gathering and celebrate the 2 years of the Applied AI efforts. And Intel is supporting us in a huge way. It's funded by DST. Again, we're one of the largest initiatives that we got funded by Government of India. Very large funding, 5 years from DST as well as part of the national mission on cyber physical systems. There's a good team now. Verma is here from Intel on secondment to us for 2 years, full time. We have a large number of engineers and other senior members hired in the Applied AI centers. And of course, the rest of the institute is all part of it anyway. The research labs, our incubator, product labs are all also supporting different activities. So it's a very big initiative for us, and we're very happy that it's 2 years now. And we are here to celebrate that through some conversations around the technology, and specifically on those two domains, mobility and healthcare, that we are focusing on. So without much ado, I would like to invite Professor P. J. Narayanan, our director, to deliver his address. Sir. This one? Either one.
Good afternoon, good evening. Good to again, like Ramesh started with, good to see all these events. Once the pandemic, the pall of the pandemic is lifted, we have events and events. Today there are 4 of them happening. You know, if you stand there, you can have one eventee or the other eventee. If you turn that side, there's some summer school happening. There is a AML something happening. There is a women in tech some event happening. So we are back. And also academic conference also happening with a vengeance last week. At this time we are in IIT Gandhinagar on the Indian Computer Vision Conference, annual conference, which happened after 3 years. Last time was 2018 here in Hyderabad. Then next physical one was this year. And we have been hosting 2 conferences here last week and this week, one handwriting recognition, one Asian conference on machine learning. And next week there is this BDA, data analytics conference. I think we are just too many, you know, we are all eating too much conference food and gaining weight again. all those quiet times are over. So anyway, I'm very glad to welcome you all to this event. So we, IIIT has always been very strong at research, and particularly in AI. Somehow we became an AI school, not necessarily by grand design, but our first research center here was the NLP, what we call LTRC, Language Technology Research Center. Then we started the computer vision, and later the data engineering or data analytics. These are the first 3 research centers. Then we also started robotics and CogSci and speech and many other areas added on the way. So, but you know, one of the founding objectives of IIIT has been also to not just do academic research, but also research that goes out onto the field. So there's only so much you can do as pure academic research is what we think. You can theoretical academic research that stays in papers and maybe some patents occasional. We wanted to be more in the field research, so we want what we call applied research. This push has been increasing over the years, and in 2020 or 2019, and many things happened. Intel, we've been working with Intel for a couple of years before that in transportation project, some of the data set and other aspects for India specific data. And they want to scale up. Government of Telangana wanted to be to partner with this, and we also wanted to do some public health related activities, which are very, very critical, very, very important, but also very, very difficult to start because there are too many players and players on the ground. We need to have government buy-in. We need to have government support. We need to have many more. So we've been working with CARE Foundation here. You're glad to see them because we've been talking to them for many years now, and so it's all very hard to do. But I think that's where the big impact is, so we are determined to do that. So together we started this entity within the institute called INAI, which is expanded as integrating AI for big population scale problem. The phrase used as population scale, not just things that work in not even a startup is enough. It has to be a population scale application. So and then exactly the same time this DST call for the national mission under the national mission on cyber physical systems happened, and we proposed broad AI area, and we they asked us to manage a what they call technology innovation hub on data driven technologies. That is the IHub, this other logo you see here. So they have very lot of overlapping goals. IHub has many things. You can do academic or other kind of research also, but IHub also is interested in working on large scale or population scale problems that affect the society. There the overlap with INAI is very strong, and we are also setting up a common way of managing the projects and the technical activity or the activity that happens on the field. So this is the setting, and I think this needs a lot of people, a lot of help, and a lot of employees. And yes, students are the important part of this kind of activities, but it is not it's not an academic project, so it's not a faculty plus student kind of project. Most of the other activities in an institution like IIIT will be one faculty, couple of students, or maybe two faculty, few students. Those are the medium to large projects that happen. Here we need to have maybe faculty involvement, but also people who understand the problem, the domain experts, as well as people who can engineer and architect solutions. These are not the students and faculty. There may be people with experience coming from the field, from the industry, etc. So we are still learning how to set up teams which are of this kind, and more importantly how to work with governments, NGOs, companies and so on to make it happen. So in transportation things have been ahead. I'm wearing this iRaste shirt. This is a project that we started started first in Nagpur with the Nagpur Municipal Corporation. I think you will hear more about it. It's about understanding the road, understanding the condition of the road, and maybe intervening. The project has CRRI, the Central Road Research Institute under the CSIR as an active partner. So the experts on what to do with these roads, how to make them safer. So this project was launched by Nitin Gadkari in September 2021, and is a very simple goal he gave. You have to reduce the mortality by 50% in 3 years. It's a very tall task, but I think it's a good goal to aspire for. And several other transportation projects are happening. You will hear more about it from Verma and others. And healthcare, like I said, we have big aspiration, but it's a slower, but you will again hear several efforts that's been at least happening. Some have set up. We have set up a micro labs on campus and trying to do disease surveillance. So varied things. We are talking to many people. There are our science and other people involved in architecting it, our engineering and AI people. I mean, hardware design is part of some of these. AI and data processing is of course part of it. So this is a way we want to bring end-to-end full solutions from institutions, and in all our endeavors, our students, not just PhD students, undergraduate students are also important part of it, and we will have several undergraduate students participating in it, and this is the best training that they can get. So IIIT has always been a research university, call ourselves a research university, because we think trying to train our students in unstructured problem solving that is involved in research makes them much better regular engineers as well as knowledge seekers. If you train them only for skills that are required by industry and so on, then they may become very good at it, but they may not be good at problem solving outside of very structured environment. So this is the philosophy with which we call ourselves a research university. We have very research oriented curriculum. If you look at it even from the very first semester, there are courses which are structured differently, which are executed differently, and we want all the students to at least get a fair taste of what it is to solve unstructured problem. That means look for solution, evaluate them, try them out, reject some, accept some, modify. I mean that cycle, rather than just do what is told in the class, do what is told in the assignment. Given a assignment in class, we know what exactly how to solve it. When you give this kind of project, we don't know how to solve it. Solving that is a whole problem, a whole thrill for us also. So I think getting into applied research area in applied AI in largely social problem or very relevant problem has been a recent step. And I also like to say that, typically academic institutions have a lot of professors teaching, and they are well qualified, they are research qualified, so they have some spare time, they also do research. This is the traditional model of an academic institution. We want to reverse that. We want to create an institution which is primarily focused on research, but still, because there is the expertise available, they will also teach undergraduates and PhD and masters and so on. Rather than using spare time to teach, we want to use the spare time to do spare time to research. We want to do the spare time to teach, so that we can grow based on the research needs, not based on the student numbers only. So I'm glad this is happening. It's the second one. I'm sure the last year was all virtual. So I welcome you all to this and have a good time. And unfortunately, I need to catch a flight that leaves at 6, so I'll leave right away from here. But have a good time. I'm sure all these people will make you, tell you about what is going on here. And I welcome those who are not already part of this endeavor to partner with us in whatever way that makes sense for each of you. And let's solve these really tough problems together. Thank you. Welcome once again.
Thank you, sir. So, no such initiative, especially an academic institution, these have to be led, right? It's at the end of the day, it's an applied research initiative, has to be led academically. So right from the beginning, we had Professor Deva Priyakumar that was involved from making the initial conversation with Intel, but definitely when we started the thread with DST, making the proposals and such, and then ever since the center became functional, so Deva has been leading it academically. Deva, request you to share your kind of reflections on the 2 years of the applied AI initiatives.
Hello, good afternoon, everyone. So thanks, Ramesh. Thanks also for putting this together, and also the others who have been very actively involved in last few weeks to put this event together. Yeah, so maybe like just Ramesh mentioned, we started trying to apply for this big grant in DST. I think this was in just before the pandemic, right? January 2020. And then I think we spent most of the first half of 2020 in just writing the proposal. It's like 240 pages.
And rewriting.
Yeah, writing, rewriting. I'm still rewriting. The still final DPR still has to be, approved by the committee. Anyway, so we spent a fair half or for a fair bit of the time in 2020 just writing the proposal, and then we slowly started our activities towards the end of the year. So when we had all the other formalities and everything else taken care of, now November 2020 is the time when we started. Of course, it was slow in terms of getting people, in terms of because this is right now we are a reasonably large organization with about 250 people on the payrolls, right? Just starting with one employee on January 1st, 2021, I think we have gone a long way, right? So anyway, so just to quickly about what we are doing or what the focus is. Our efforts has been, or the mandate given to us by DST is, like multiple areas around data, or we call it data-driven technologies in short. But so the idea is, can you do technology development and then applied research, translation, and then do startups, connect with startups, and then connect industry, connect society, connect, and so on, and also to train students and other engineers and scientists in this particular area. So, like PJN mentioned, there are some areas which we are very strong in, for example, the research itself, right? So that has reflected quite nicely in what we have done in the last 2 years. We have, gone, we have progressed quite a bit in the areas of mobility and also in healthcare to a large extent, where we have focused on developing quite a number of data sets, and then develop technologies for whether it's road safety or for like cancer screening and different areas within healthcare. So I think as academicians we are reasonably strong in this, and then we have been able to do. So the other area where we have had very good success is, again, mobility and healthcare. We are not the only ones doing within IIIT. We have, close to 20 projects that we have given to others, not necessarily within IIIT, but also outside, where they contribute to our goals of, making, inroads into areas of mobility and healthcare, and also slowly diverging into India-specific problems such as judiciary and things like that. And then this other one is training manpower. We have been able to again, give out close to 200 fellowships at multiple levels, like masters by research students, PhD fellowships, postdoc fellowships where we train, post PhD, and also faculty fellowships. I think we have only 1 or 2 right now, but we have done about 200 fellowships where all of them are trained very rigorously within different research groups. And another level, we have reached out, or we have touched close to more than 1,000 students via various programs. Like Dr. Raju, who is here, he's running like year-long courses in machine learning, foundations in modern machine learning methods, multiple batches, and then we also did some course on machine learning for drug discovery and many other short-term programs, right? So, so we have been able to work with large number of students, and we do know that they have been benefited. So the other 2 areas where we have been trying to try and break through is, one is in data foundation, where the idea is can we have all the infrastructure, both in terms of software, hardware, and the expertise to host any kind of data that anybody wants us to host, right? Not only just host, but can we provide them technology using which they can convert their raw data into usable data for developing technologies, right? So this is one direction where we have been struggling, but I see that we have done reasonable progress now. And second one is, again, which we are not very strong as academicians, is in translating the research that we do, right? So again, that's Varma is leading now, and I hope we will have good progress this year in both these areas, right? So of course, Ramesh is extremely strong, in startup connects and so on. We have been able to support close to 20 startups so far in different forms, different schemes, and we also hope that some startups come out of our own work and things like that in this year and the following years. Right, so this in summary is what we had been planning to do initially, and how we have traveled in brief, right? So, but I really hope that we will take our activities to the next level, hoping that some of you will be able to connect with us in whatever ways possible, right? Whether you're a student, or you have a startup, or you're an industry leader, at whatever levels, please, look at what we have done in more details in the next couple hours, and then see if you can connect to us and, make better things together. Yeah. So with that, I'll stop, and thank you. Yeah.
Thank you, Deva. I think the fact that we started in the pandemic and managed to do so much, I think is very good, and I'm sure with now things getting back onto full swing, more or less normal functioning, I think the year 3 will be fantastic. So Deva did refer to Varma. Varma has been with us for almost 2 years now from Intel. He's on secondment to us, and brings in a completely different perspective to all the efforts, especially on the research projects, translation projects. So, so we're happy that Varma has been with us, and hopefully we'll get another year from Intel, 3rd year. We just assumed he's here next year, though we never discussed formally. So Varma, thank you so much for all the time you give us. And Varma also personally leads the mobility projects, apart from anchoring all our research translation efforts. So Varma, your update on the mobility projects.
Sure, thank you. Welcome everybody. So as Ramesh mentioned, right, I'm on secondment from Intel. So this is, it's totally different experience for me, coming from the industry and dealing with academia and government, right? It's a whole different thing, right? But being here helps a lot, right? Earlier when we were working with folks, we sit in the corporate environment, but just be in the meetings. That's one thing. But sitting here and be physically immersed in the environment, right, makes it a totally different experience. Right? So as a PJN and a Deva alluded to, right, the two focus vectors for our applied AI research are mobility and healthcare. And Professor Bapi will talk about healthcare stuff. So I'll talk about major projects in mobility, right? We have a lot of small projects too, right? But I'll touch upon the major projects. So the effort is focused on 4 vectors, right? The first vector is road safety, right? And this is where I'll talk about our 2 headline projects called IRASTE, where the focus is, again, using all this technology that we are developing to actually make a difference, right? Make a difference on the ground. So here the goal is to actually use AI and other things to actually reduce accidents. As you know, India leads the world in terms of the number of road accidents and deaths, right? So anything we can do here will go a long way, right? Whenever we go talk to any government officials, especially the ministers, when you go talk to them about technology, the number one question on their mind, tell me how you're going to make a difference on the ground, right? So this is one project, right? One vector along that lines. And the second thing is road experience. Here we are developing solutions to either help automate the road infrastructure or actually help the government officials with enforcement solutions. I'll talk about some of them. And the third one is what I call IDD Dataverse. PJN briefly talk about this thing. This is something that we've been doing for 5-6 years with IIIT here, between Intel and IIIT. This is IDD stands for Indian Driving Data Set, right? So this is actually a only one of its kind data set. Now there are new ones coming out, which is the driving data set for Indian driving conditions, right? Most of the data sets out there, if you see, are essentially Western countries, right? US has data, Europe has data. But if you want to develop algorithms and are looking for driving conditions for India, this is one of the biggest ones out there. And the fourth one is what I'm calling mobility platforms. These are platforms we're developing for people to actually either collect data, that's one we have actually spent some time on. And the other one is on autonomous driving. So we have Professor Madhav, who's been doing work on autonomous driving for a long time, right? We actually have 2 platforms that we use for development, right? I won't talk much about that. I'll talk about the other things. So first one, IRASTE, right? So this is, so we have 2 of these running now. The first one, it's in Nagpur. And if you see on the bottom, you see the consortium members, right? Something like road accidents is not a simple problem. There are various elements to it. I mean, technology is one element, but there is, the engineering element, there is awareness, right? There's a whole lot of factors that go into it. So the consortium you see here, right, other than us bringing technology, whether it's INAI or Intel, right, IIIT, we have Mahindra, who have done a lot of work on the Mumbai-Pune road corridor, right? Over the last 10 years, they were able to reduce the number of accidents on that corridor by 50%. That's a huge, huge metric, right? Then we have CRRI, who is the Central Road Research Institute. They're the premier institute in the country in terms of road engineering, right? So the 3 aspects here. The first thing is vehicle safety. Here we actually put ADAS devices. It's essentially camera looking at the road and gives alerts to the driver. So potentially like 2 to 3 seconds before a potential accident can happen, right? So these we have put on the buses plying in Nagpur. So this is the first aspect, which is equip the driver so that the driver can be better, right? And the second aspect is the road engineering part. Irrespective of how good the driver is, if the road is bad, the road geometry is bad, there's nothing he can do. So here is where we do the second part of the work, where we actually have solutions to actually improve the geometry of the road. And the third one is what we're calling a new concept called gray spots, right? So on these roads, we have what we call black spots, which is where accidents and deaths happen, right? You look at the last 3 years of the data. But things have already happened there. Accidents have happened. People have died. Is there any way, I mean, we have 250 buses equipped with sensors, right? Cameras generating data, alert data. So we aggregate all this data and look at hotspots, right? Which can potentially become black spots in the future. So here we work with the municipal corporation and the traffic police and others to see if we can take some measures so that we can avoid these gray spots becoming black spots. Right? That's how you save lives, right? Okay, the black spots you can fix some of the geometry, but people have already died. If you can predict where the spots can be, then you can do better, right? So this we have been running almost for 1 year in Nagpur, right? And I talked about most of the stuff here, right? Equipping the vehicles, right? Finishing all the DPRs for all these 38 black spots. Now we're working with the road running agencies to actually implement those changes on the ground, right? That's a lot of effort, by the way, right? I mean, technology aspect is one thing. I mean, there are a lot of government agencies you need to work with, NHAI, PWD, right? And then for them to get moving, you can do all the prep work, recommendations, detailed project reports, to get it into motion, into their budget and approval and do actual changes on the road is a lot of work, right? And then you work with them on the gray spot, saying that here is a gray spots, and we work with a lot of NGOs also to run actual awareness campaigns along these gray spots, so that all the people who drive around those gray spots actually become better drivers. There's a lot of elements. Technology is one aspect, obviously, but there's a lot of elements: engineering, awareness campaigns. So the minister has a lot of expectations from this thing, and we're also driving it accordingly. So we'll see how this goes. So far, right, we've been able to see initially good results, right? And then on top of it, the drivers, right? Once we put the devices, the first 2 months we've seen good results. But then, like with any technology, the third month again they start, they stop ignoring it. So you'll have to keep constantly enforcing, right, better driving behavior among the drivers. So we do a lot of that. So that's Nagpur, right? Then we have another project in Telangana, right? Nagpur is in the urban environment, but if you see the accident statistics for India, 50% of them happen on the highways. That's only 5% of our network. So if you can actually address the accidents on the highway, even an incremental improvement will go a long way, right? So here in Telangana, we're focused on 2 highways, the Hyderabad, Vijayawada, and Hyderabad, Bangalore, which are the two busiest highways, right? So we launched this recently in July, right here in this room, right? Minister KTR was here, and we had a bunch of other dignitaries who launched this project. So now we have around 100 of these ADAS devices installed on the buses that ply on the 2 highways. And I'll show some initial results from these things, right? So the graphs you see here, like for example, this one is the GIS database we prepared of Hyderabad Bangalore highway, and the dots you see are all the black spots, right? So that means deaths have already happened on there, right? And then this one on the right is where the map of the buses flying, right? So we have alert data of drivers driving on all these routes, right? And how is our data helping them, right? So here is one example. If you see this graph, right? So these devices give various kinds of alerts. If the driver is getting too close to the bus in front of him, or if he's taking, changing lanes without having without switching on the things. So we collate all the data, and then we can tell for each driver, right, how good or bad he is, and taking all that collectively, which are the areas that this fleet is doing good or bad. We feed this all back to the TSRTC. We work with TSRTC depots, and then they work with the drivers, right? That's one aspect. And then we have to work with NHAI and the other folks to actually do DPRs for the black spots on these highways, right? Then implement those changes. Right? So this is, we kicked off 3 months ago. We see good stuff going on there. So that's the road safety. Then let me move on to road infrastructure and enforcement. So here I talk about 4 things that we've been working on, which you see here, which is, by the way, these are all camera based, right? Just camera, no other data. So all the data set size, and you see the type of data. So this is like triple rider detection, no helmet detection, pothole detection, and tree counting, right? So, and you see the model accuracy there, right? So this one, the pothole one is, pretty mature now. We can deploy it. So this one we're working with GHMC, where that is a ring road, right? So we have our car go around, collect the data on the ring road, and you see some of the density potholes on the ring road. So we can use it anywhere. Now we're running the same thing in Goa, on the roads in Goa. Second one is tree counting. As you know, right, there's a lot of trees getting planted all over the city and all over country, right? We have Harita Haram here, right? Thing is, the government wants to know how many of the trees are growing, how many of them are alive, and they can't go count, right? So this is where we use technology. We put a camera on the car, and just run it, and then we can automatically detect and tell the government this is how green this corridor is, right? And then for the enforcement, here you see an example. So this is we already have this working where the traffic police we're talking to see if we can deploy it just with the camera-based thing. Here in this picture you see we can detect automatically on the bikers who have no helmets and also bikers which are triple riders, right? And the traffic police are very interested in this stuff, right? So these are examples of things going beyond research and actually have real implementation out there, right? That can make a difference down there. Then IDD, right? So this is the world's first database of unstructured driving data conditions, right? From India. So this has effort started way back in 2017, right? So a lot of work went into it. Professor Jawhar, if he's here, yeah, he's there, right? So he's been working with Intel very closely on this thing, right? So 5 different data sets were released, and we have 8,000 plus users using this thing. I mean, we release it mostly for mobility, but there are a lot of other kinds of mobility also, not just on the road, that use this data set. Because this unstructured data conditions, right, you don't get this kind of data anywhere else, right? Or nobody has put it out there, right? So on this one, the latest one that was done is IDD 3D. All the work that is done so far is just based on the camera. So this one is now has LiDAR data also included, right? And then the team has almost like 6-7 data sets more planned in the coming 1 or 2 years, right? So this has been a great effort over the past 5 years, and the team continues to add more and more data sets to this thing. The last thing is the platforms that we are building, right? So this we calling it Bodhyan. Again, the minister launched it in July, right? So it's essentially, we had a couple of cars before to collect all the IDD data. Now we added a lot more elements to it, more cameras, now a LiDAR, and also some processing power right in the car, right? So any company which wants to do some work, right, they don't need to start from scratch. They can collect the kind of data they want to collect with this car. If they want to add more sensors, they can add it so that, they can get going, right? So recently we had T-AIM from Telangana government. They wanted to run a pothole challenge along with GHMC. So they took this car, the GHMC identified a few roads, they ran this car, collected all the data, and then almost like 100 startups worked on it, right? So we expect a lot more companies to use this platform in the coming year. So that's just a brief summary of the various things we have, right? It'll take a lot longer if I keep on going, right? So I'll stop there, right? And I will pass off to Bapi for the healthcare updates.
Thank you, Verma. So we'll have a little bit more on it when Jawar gives his dean's address in a little bit. But right now we'll have Professor Bapi Raju, who leads the healthcare vertical in all the Applied AI initiatives, to share an update on some of the projects happening on the healthcare side.
Good afternoon. Welcome to this second annual conference on data-driven technologies. Happy to be presenting what is the current status in healthcare projects, and thanks Ramesh and his team for organizing this. the last 2 years, 1.5, 2 years, we have been engaged in this, started this mission of population scale healthcare solutions in both communicable diseases and non-communicable diseases. And I'll give you a couple of examples of these. That efforts focused along 4 vectors. One is early screening and diagnosis. The idea is to identify biomarkers that allow you to screen various disorders in early stage so that intervention can be effective. In most cases, one example we'll see of oral cancer where this is very critical. The second vector is intervention, where the idea is to develop precision therapeutic solutions. The third is public health, where we plan to develop solutions to assist healthcare delivery at the primary health centers and other rural health facilities. And the fourth is explorative projects. Some examples I'll share. So on the right side you see the NCDs that we focus on. Cancer is the prime disease that we are focusing on currently, but we are also planning some projects in cardiovascular disorders as well as in cognitive aging and neurodegenerative disorders. In the CD, communicable diseases, we have set up a genome sequencing facility called Microlab. This is actually supposed to be a sequencing facility that can be taken to the field. Of course, the samples come now to IIIT, but in principle, this equipment is designed to take it to a remote location and be able to sequence along with cloud connectivity and give you an idea of what sort of genetic composition a particular strain of virus or organism that you are looking at. That's the idea. Right now we have set up a lab here where the samples are brought here and we do that. So let me take you through a couple of these. The first one is AI-driven predictive model for cancer probability in variety of cancers, oral, breast, lung regions. And this is a project we are doing in collaboration with Grace Cancer Foundation, of which Dr. Chinnababu is right here, the oncologist from Apollo as well as the prime mover at Grace Cancer Foundation. With his help, we collected samples of oral cavity. The idea in this project is to take photographs with an ordinary mobile camera, the oral cavity, by a professional who is not trained, not necessarily a healthcare professional, but maybe a allied healthcare professional or a healthcare worker who works in this. You take this photograph and use the features from this photograph to identify if there is a suspicious lesion. If you see lesions and that require further workup, right? So suspicious and non-suspicious, this kind of binary classification is what, and we have currently samples close to 500 samples that we collected from our efforts, plus additional images that we got from our collaboration with Biocon Foundation Bangalore. And the model currently with an accuracy of 0.85 is being right. So some of the pictures of the bus that goes to the camp and the training of these professionals that go to the camp to take the pictures, and some of the images from this database. So in all of this, let me pause here, and in all of these solutions, our idea is simple, that you curate a data set And because, as you know, ML and deep learning algorithms require a huge amount of data for building the model. So you collect the data, curate the data, which includes a lot of steps, including annotation by experts, right? So you develop this data set, build a solution, that is build the AI or ML model, and then use this, deploy this in the field. It sounds very simple, but as you know, there is a lot of slips between the cup and the lip. Right now, talking about the cup, we have just started boiling water. The tea is not ready, and the cup and the lip and the slip is further away, maybe 2-3 years away. Right, so right now we are getting the taste of boiling the water, and what you see is efforts in that direction. So the second dimension that we wanted to look at within the cancer is to develop a pathology data set. There is no large-scale Indian pathology data set, and this is a broad phenomenon in the healthcare sector. You look outside India, UK has its own biobank, US has its biobank, Japan, Korea, China, Taiwan, any of these countries, they have their own large data set, gathering efforts. There is a human connectome project which takes brain data, structural, functional data. There is a human connectome project, US, Europe, China, Japan. We are yet to see an Indian data set. In that context, this kind of curating this data set is a very important first step in bringing our own solutions to our own problems. And some of these, for example, some of these may not yet be taken up, by any other people because these are rare conditions. Right? So these happen more in India. So Indian pathology data set, the idea is to curate, collect data, curate, and make this available for multiple purposes. Of course, one major purpose is to take this whole slide image. And you take biopsy, you take the tissue, put it, mount it on a slide, put this under a slide scanner, and you get a digital image. Now the work can start. Right? Use this image to annotate what are healthy parts, healthy cells, which are cancerous, suspicious cells. You need to do this annotation. And so you need a whole ecosystem for making this available, right? We need to crowdsource perhaps, we can have to bring in experts that can look at this, annotate this data. Once this is annotated, you have the effort, already we have some experience in building models that look at these histopathology images and do classification, cancerous versus non-cancerous. So why is this important? This is important because you go to cancer, I don't have the numbers here, but cancer is assuming a proportion, epidemic scale proportion. So there are a lot of cases that you take the sample in a secondary or a primary hospital at a very remote location. It needs to be currently sent to the nearest district or city center where a histopathology expert who specializes in oncology, cancer pathology. And Dr. Vinod, who is sitting here, he's actually driving this effort. So he tells me there are cancer pathologists. First of all, the number of pathologists per 1,000 people is very less. Of those who specialize in cancer pathology is even, right? So these numbers run in fractions. So it's a matter of 2 decimals or 3 zeros before a real significant number begins. So it's a real need for an automated diagnosis. If there is a suspicious biopsy sample that needs to go to the next level in terms of alerting the patient to reach out to a professional and so on. So this IPD is the first step in that direction, and we have currently collected, we have a collaboration with Nizam's Institute of Medical Sciences, NIMS, here in Hyderabad, from whom, and also Apollo Hospitals, 2 pathology centers, and we are in conversation with several other, including Tata Memorial Hospital, Regional Cancer Center in Visakhapatnam, and so on. The idea is to bring samples from them, the slides from them, scan, and then populate this database and curate, annotate, then develop the model. Brain samples 257, lung, colorectal, cervical, oral. These are the 5 largest incidents, cancer incidences in India. So we want to take this forward. We also have now put a scanner on site here in IIIT. It's a lab where we put the scanner, we bring the samples, the slides, and do this. We also have a scanner installed at Nizam's Institute on site, so for ease of data collection. The second idea is that was NCD, non-communicable disease. In communicable diseases, one of the felt needs was to see what sort of genetic mutations and variations that are there. This actually started during the COVID time. Of course, it took some time to establish this genome sequencing facility, but now it's up and running. You see these pictures. We have processed about 40-50 samples, about 38 or 40 samples are COVID related samples, the remaining dengue samples. So the idea is to develop as sort of a dashboard, genomic surveillance dashboard, where we upload what are the mutations that we see, seasonal, some of the seasonal diseases like swine flu, dengue, or also TB, leprosy, the sample collection, connecting with sources, either government hospitals or other pathology labs. This has been a big stumbling block, but we have right now 2 people on board, CPATH Labs and Lepra. And Gandhi Hospital, we are still talking to them in terms of getting the samples and doing this. Idea is to develop, give on the dashboard what are the mutations that are happening. So this kind of a surveillance dashboard is useful for public health policy makers, decision makers, and other clinical professionals who see what sort of treatment strategy that they might take that is appropriate for these variations. So other vector that we have significant progress on is this intervention vector, where we have developed a protein ligand data set, 5,000 sample data set, 20,000 and 100,000 is in pipeline. These data sets are useful for drug discovery and developing technologies for precision therapeutics. And we are working with in silico medicine closely on this, and we are also in discussion with other players in this field. And public health, we are still talking to Public Health Foundation of India and others who are in this, in developing AI solutions that help healthcare workers like ASHA workers or nursing midwife people to be able to diagnose common conditions that are that happen, that can be quickly diagnosed with the help of a technology or AI driven solution. And in the explorative topics, we are engaged with NIMHANS, National Institute of Mental Health and Neuroscience at Bangalore. We are developing a solution for them to automate sleep stage scoring from EEG data. In many of these cases, in stroke, people are called to the lab 8-hour sleep data is collected, and this is a huge amount of data for a person to sit and manually label. So this is awake stage, this is sleep stage 1, N1, N2, and rapid eye movement sleep. This annotation is hard, and current solutions that are bundled with these polysomnography machines. This PSG is a machine that actually does this multimodal data collection, both EEG, heart rate, this chest movements, amount of oxygen that is going into the system. All these are monitored. And we have already given them a solution. This published in MICAI 2022 last year. This is the beginning of this year. That we are now bundling that into a solution that can be given to such sleep labs. Nimhans is our first such customer. And we also have projects in COVID and cognition, the impact of COVID on cognition. This is called the long COVID. We have a project where we are doing cognitive testing on patients who recovered from COVID to see if there are any memory related or attention related problems associated with the COVID. Music and social media and connection to depression. This is another project where we have people enrolled in our project whose Spotify and other listening lists are taken along with the anxiety depression survey that they take, and we are looking at correlations as to music listening patterns and other social media patterns that can be used as triggers to identify anxiety and possibly depression. Right, so these are, and a couple of them in pipeline. In cancer data, apart from taking this oral cavity pictures, we also want to link it to genomic information. So this is a project we plan to take up with the National Institute of Biomedical Genomics in Kolkata. And CVD is the cardiovascular disease identification with the CARE Foundation, and the aging and neurodegenerative disorders is another project. These are being launched as we speak. From next year, we'll have activity starting along these dimensions. Right, thank you.
Thank you, sir. And of course, the recent thread from the government on the whole the cancer data set, hopefully that will work out. It's a very large initiative. If it works out, we may get access to maybe thousands through M&J Cancer Hospital. That has just started. Let's see. Hopefully that will happen as well. It will be a very large data set. Yeah, any interactions, please. We just have a packed agenda. We can do the networking and dinner. So I know there were some questions, but I would just ask you to hold on to it, and we'll do it over dinner. So thank you. So before we move to the plenary panels, we'd like to now invite our Dean of Research, Professor C.V. Jawahar, to share his thoughts. I mean, he's been very, very involved right from the beginning at the right center and forefront of all our applied AI initiatives, and specifically the plans to launch a larger mobility simulation lab. So Jawahar, your reflections.
No, this has been a This has been a great journey. So we have been hearing this slogan of data as the fuel that is going to change a lot of things. And I think the slogan was on the rise when we got into this. Now surely now we have the glimpse of what type of data that we are going to have and what type of data that we are going to get. We have a lot of open threads, and we have collected a lot of data, both. Now we are also talking about how this data is getting used in terms of what type of technologies that you can develop based on this data, and what are the immediate avenues where this sort of technology solutions can reach the end users, the society, the population, the common man, this has been always the key thing that the translation or innovation have been talking about. So I think there is given that we have some breathing time now, with a first lap getting over. So as a university or educational space institution, we also ask about what are the fundamental problems that are going to come in this space. So immediate needs are understood, there is a data, there is a solution. So I'll take this example of what we have been talking in the space of mobility. We started with the data, then we talked about solutions like Verma talked about this traffic violations and other solutions. Now we ask a deeper question, so why is this happening? Why is this Indian roads are unstructured, or why is that we have accidents, or why is that the what we are afraid on the road is like every day happening here, there, like, so why? So the answer could be very deep, and we very often say that, look, this is what can I do if government doesn't have money to build roads, what can I do? Is it all the government's fault? I don't personally think so. So one observation that we had was there is a need for even education. So all of us have a driving license, and I'm not sure how many of us have actually learned to get the driving license. So there is the space of education is practically missing in the mobility. So we were thinking like, look, is it that as a university we should do something in mobility education? And of course we are finding a very interesting scope for like getting into this space for teaching the kindergarten kids of driving to veterans of driving. We have opportunities at all levels existing today. But what is the education in mobility? So we thought what could be the experience or what's the issue. The closest that all of us know is this, like a pilot simulator. The pilot simulator, aircraft driving simulator. Why they do simulator? They cannot train on the actual aircraft. So you need to do a simulator, you need to have education, training done on a simulator so that you drive and learn and then maybe actually fly the actual one. So it gives such a simulator, usually gives you control, feedback, and you feel like you are actually driving something realistic, and that helps you to be a better driver or a pilot or whatever. And of course there is a track on how do you automate that maybe running parallel, but we are not still seeing a situation where human is not there. Maybe 80–90% of the flight travel could be autonomous today, but still there is a need of a pilot. So this is what we thought we should do surely. Okay, nice, good way to start. Then we suddenly realized that this is not going to be over, because what the aircraft can fly in the air where there is nothing to be seen. While the driving in our situation is very different, we want to have the Indian look and feel. And what's the look and feel? Starting from the narrow roads, the cluttered roads, to whatever on the side, what you see, like big billboards, movie stars standing on the side and inviting us to watch their movie, politicians standing on the other side and inviting us to distract the driving. All of them has to be realistic. Otherwise the driving simulator or training is not going to work. We need to bring that. Not only that, there are a lot of interesting Indian issues, starting from whom are you training? If you are training a typical driver of Indian, I'm not even sure this person is you can train this in English. The government is today talking about all the IITs should teach in local language. At least the driving should be taught in local language. So there is a role for like a visual language, like a type of issues to go into this space. So it is, so the driving simulator, we hope, should have this sort of holistic experience of how do you do that. Now, is that the end of training? No. Is that the only way that we can use this? Today, if you are developing a technology, you cannot actually pilot this on the road. So we would like to have a mechanism where we want this experience to be scalable. So for example, like one question to ask is, if I build a Hyderabad outdoor and train somebody here, nice, but this guy is going to drive on a long trip and could go to the hills. So is it possible today that your driver can be simulated in novel Indian environments which you have never even seen? And there are a lot of interesting academic research happening in this space. You can simulate different effects, like a rain. So you have not driven in the rain. How do you train people to drive in the rain, or in the fog, or in narrow roads, or in a steep climb? So this issue of the environment, can you learn? So there are interesting machine learning algorithms today which will help us in creating such simulates a novel, realistic situations for training people. And that is the part of the plan. That is not enough. We are developing technology now. How do you pilot this technology? How do you test this technology? We have a lot of data available of, say, Hyderabad roads. Now, assume you have a technology which is for detecting, so the type of example that Verma showed about, say, helmetless, etc. So you can actually do a good amount of them offline. On a canned data, you can do offline and report results as an academic research. But if you ever want to test a real technology in the field, so this is also a platform where if you have a technology, you can plug it and see whether this is going to improve the driving situations. So I'm not sure how many of you are aware that this autonomous driving research today has increased the efficiency and safety of vehicles a lot. Because you may have a lot of data coming about how you are, say for example, how are you going to operate your braking systems? What is the most efficient or right way of doing various controls? This can be learned from the data, and your electromechanical systems can be improved. So over time, autonomous driving may be a funny or a big goal, particularly for a country like India. But its side products, we have started to see a lot of impact on the manufacturing of different vehicle parts. So we hope the simulator is a place where if you are developing a technology to pilot this. So not only this, so now such a facility could be also useful for people if you want to use this. So this is like as a hub, or as a academic institution, as a hub, as a project. We also look at this sort of a facility to be available for public. So we find that this area is difficult to enter. The entry barrier is high. If you are a small group, a university or a small startup, if you want to ever do anything related to that mobility or larger things, like you may need hardware, facility, testing, scale, is it possible for us to provide this as a facility available for the larger ecosystem in the country to play with, so that more and more people will be able to join? So these are the few thoughts that we had about when we are talking about this simulation. So we have a lot of independent activities that are going on in the lab already, in terms of, say for example, as I mentioned, how do you simulate novel driving situations? How do you do that in a controlled manner? How do you use such a simulated data? Say for example, the experiment that you cannot do in the realistic road driving situations, can we do in a laboratory situations? So a number of such independent pieces of research that we have already going on in the lab. Now this sort of a simulation lab or a driving situation mimicking is going to put a layer on top of it and provide it as an infrastructure or a facility which enable the research, development, and service of this to the public. That's the plan as we have. So I'm sure in the next few years, the hub is going to take this sort of technologies, so the data, the technology, and addressing the root causes from different angles in mobility, healthcare, and many other areas. And we are all looking forward towards that. Thank you.